to the Power of One. Today, I am extremely happy to be speaking with Kyle Carter from NAMI. I love when we have free resources that are going to help everyone, especially young African American men in the city of Philadelphia. Welcome to the show, Kyle.
Thank you so much for having me. Good morning.
Kyle, please tell the viewers who you are, what you do at NAMI, what NAMI is, and then the structure of NAMI, because I see NAMI in different counties. So break
Absolutely.
everything down for us.
Okay, will do. So again, I'm Kyle Carter. I'm the Chief Executive Officer of NAMI Philadelphia. So NAMI, the National Alliance of Mental Illness, is a national organization, 600 affiliates, organizations all throughout the country. And our work as a conglomerate is just to remove the stigma around mental health. So we have multiple affiliates in our area. We have Montgomery County, Bucks County, Chester County, and Mainline. And then we have NAMI, so I think it's 5 total. And again, our work is very similar. Again, removing the stigma around mental health. And our work really sits in 3 tenets. So that's education, advocacy, and training. So our work all sits in that spaces, and it ranges from signature programming. So our peer-to-peer, family-to-family, and that could be in presentation or training form. And that's really equipping folks that are caring for folks that have mental health and behavioral health challenges and giving them best practice. How not to pour from an empty cup. How can they best support the person that they love the most? We have youth-based programming. We have mentoring programming. We have programming in which we help take that walk alongside families and youth that are navigating the behavioral health system. We have what we call our youth peer specialists, in which we are positioned in high acuity, high trauma, high violence areas of the city. And we partner with community organizations to be right there and deliver behavioral health resources, mental health resources, and connections right there in person. We also have our warm line, which is our non-crisis hotline, in which folks can call in and get connected to behavioral health and mental health resources. I'm trying to rattle off all these programs. We have exponentially grown over the past. I'm going on 2 years in my leadership. We have college-based programming, our NAMI on campus program that's in all the large colleges around the city. So that's your Temple, your Penn, your Jefferson, um, your St. Joe's, in which they mirror our composition. So they help support students in the college setting with mental health, behavioral health resources. They mirror our composition with our board. And we basically are kind of the big brother to help deliver resources to support those folks that are navigating through the college journey. And we actually have completed a complete continuum of services for college students. So we have high school students now. We have NAMI on campus for high school students to help them navigate through the college picking process. So we have that. Then they go to NAMI on campus. So they're in college. And then the post process is what we call young professional leaders, in which folks have now navigated through for the college process, but now you have to have a job and you have to create a budget and you have deadlines and all those things. And how do you manage all the anxieties around that? So we're getting to the space where we have a full menu of services and supports, but I'm very happy with what we've achieved so far.
And Kyle, are these services free?
They absolutely are. Everyone 100% free.
Okay, so no insurance or anything needed.
Absolutely not.
You spoke about something about a warm connection,
Line. Warm
a warm
line.
line.
Yep.
Okay, go more into what a warm line is and when will people access that? And how can people access that?
Okay. So you can for all information about our program, you can go to namiphilly.org. That's NAMIPHILLY.org. And that has a breakdown of all our programming, all associated phone numbers. The phone number for the Warm Line is listed on there as well. And again, you can call in, and it's essentially a partnership between us and 988. So 988, or the Philadelphia Crisis Line, they're crisis level calls. If you're in a mental health crisis, you always call 988, and we'll connect you. We do a bit of a triage service, and what you call us, we find out what you need, and then either we can help you if it's non-crisis, or if it's crisis, we connect you immediately to 988. But some services that often when people call us is getting connected. I need inpatient for my uncle. I need inpatient or outpatient for my youth, things like that. And we have a whole dossier of different resources that we can connect you with directly.
Speak about what a neighbor would do if another neighbor is harassing them. And it seems like mental health is present, but the neighbors do not want to call the crisis hotline because if you get someone 302'd, if they get 302'd, by law, they can ask who called and they can be told, correct? What do you do in a situation for like neighbors who are just being harassed by someone who has a mental illness?
Great question, and it's something. So previous to this, I served in leadership for DBHIDS, Department of Behavioral and Intellectual Disability Services. So we would get calls like this. And the number one thing in all transparency, I would tell you when there's an issue like this is to always contact law enforcement in a space like this. Because again, we want to be careful on where our work begins and ends. So one of the things that we additionally do is crisis intervention training. So we work with law enforcement to create proactive approaches, again, around best practice to help arm them when they are dealing with folks in the community that have mental health and behavioral health challenges. How many times have you seen in the news when somebody is having, especially of color, that is having a behavioral health or mental health challenge and it ends up in an adverse situation? Sometimes death, a lot of times a physical situation or arrest. When if they're armed with the proper resources and techniques and intervention strategies, a lot of that can be mitigated. So what we try to do proactively is work with law enforcement, and we do it with EMTs, we do it with the fire department, we do it with the Philadelphia Police, we do it with the state police. We conduct trainings all throughout the year to arm them with this, so that when we suggest that we connect folks to law enforcement to deal with issues like you just mentioned, they have the proactive strategy. And they have a whole CIT team within Philadelphia that handles things like that. But we're very careful about where our work begins and ends. So something
Mhm.
like that, we would refer them to law enforcement.
Today, it seems that many people, not all people, but many people are angry. And I know COVID did a number on so many people, including me. So many people lost loved ones, and domestic violence victims were probably more abused because they were stuck with their abuser. Do you think COVID played a part in exposing more mental illness for people?
It's interesting. This time last year, we had a Fox 29 special, and in this, we talked about a lot of the same things, but more attributed to youth. Why did we see such an uptick in trauma and depression with youth? And I spoke a lot about the integration of what the COVID did and the fact that we were in the house for months and months on end, which is this is an unnatural environment. So we weren't talking, we weren't seeing people in person because you didn't have that social communicative normalcy. It led to a lot of depressive states. So I do think that it's exacerbated a lot of challenges, a lot of violence, a lot of things because it's just with you and that person. There's nobody else to interact with. So you just saw this uptick in a lot of things. So it was incredibly unfortunate, awful timing. And you did see, unfortunately, the data does not lie. You saw a lot of uptick in those level of incidences. So yes, I agree.
Now, does NAMI serve a lot of, in the Philadelphia area, a lot of young African American males?
Absolutely, absolutely. So, in the interest of full transparency, obviously, I am African American. So, coming into the role within the last 2 years, I've made a concerted effort, and this, we did this with DBH as well, is to being completely inclusive, is to serve everyone. So that's all races, genders, etc. So, but I did want to have a bit of a focus on serving the African American community, the BIPOC community, in more of a macro sense. So, yes, every support we have a BIPOC support group. So we have 11 plus support groups in addition. That's one of the things I left out because it's a lot. We have a men's support group. We have a number of different things, and probably shouldn't be saying this quite yet because we haven't finalized it. But I'm gonna go ahead and say that. And in April, we're having a entire event for around Black women to support Black women, the very unique mental health journey that Black women go through. We'll have speakers, we'll have performers, all that good stuff. So I say that to say, yes, there's been a concerted focus to focus on a number of groups, and it's not just African American men and women,
Mhm.
also South Asian, the Spanish population. So a number, I'm being very intentional about showing the inclusivity that we provide that maybe hasn't necessarily existed in the past.
What do you do, or what does someone do when there is a mental health crisis? And again, I understand that fine line between law enforcement, NAMI, and other agencies that offer mental health services. What do we do 2 o'clock in the morning, 3 o'clock in the morning? You know what I mean? After the normal business hours, is that when 8 comes into play, and then your warm line?
So our warm line is very it's nine and between 9 and 4 Monday through Friday. That's when you can get a live person. That's from Monday through Friday, 9 and 4 approximately. After that, on 9 hours, we have our you can contact us where you can send us emails, and then we check it periodically over the weekend, and we'll get back to you within 48 hours. So that's what we do for non-crisis situations. However, if you're speaking to a crisis level situation, it's midnight, it's 1, it's 2 o'clock, it's 3 o'clock. Somebody is just an absolute crisis. 988. Always call 988. They're 24/7, 365. That's what you want to call.
Okay. Now, you did say that NAMI is in the schools.
Yes, so we are connected with and we have wonderful partnerships with the school district of Philadelphia and various schools. Shout out to Dr. Jamie Banks and a number of folks within the school district. So we do partner. We have a number of things we do in the school. So we have a mentoring program and we work with youth in different spaces. So we offer a mentoring program through a Trauma to Triumph grant. And we partner with Achievability to work with students that are matriculating through the Philadelphia School District to offering mentoring supports for them. We also have our youth peer navigation service in which we help youth that are obviously throughout the Philadelphia School District navigate through the behavioral health system. And additionally, we have partnerships with schools throughout the city to offer a therapeutic songwriting program. And
Hmm.
again, our YPN Ashley Murray, I want to give her a huge shout out. She created a whole curriculum and program in which we utilize songwriting, the power of songwriting, to help youth get out some of those emotions that maybe they can't articulate verbally. They're able to get it out through song and art and creativity, which is incredibly important. You got to have an outlet, and sometimes the outlet they need ain't the one that we think they need, and we have
That's
to be
true.
open and malleable and flexible and allow them different platforms in order to do so. So Ashley has done a phenomenal job. We've given this presentation to a number of schools over the last year, and we have a number of which lined up this year.
So that reminds me of conflict resolution. It seems that that is failing some of our young people today and how they deal with some issues. How do you think we got here? I mean, you may not know the answer to this question. I don't know the answer to this question. It just seems like things shifted over the last 4, 5, 6 years where our young people, like what I see on the news, which is disgusting. How can some young teens physically assault seniors? Like that's just unbelievable. How did we get here? How do you assault an adult? How did we get here? And do you have any thoughts behind that?
So I have a few thoughts, but I want to preface by all my thoughts by saying I don't have all the answers. I probably got about one, and I hope it's a reasonable answer. I will say that first, I feel like the city is in a much better place than we were.
Okay.
And I will attribute that work to as far Mayor Sherelle Parker. Again, I'm not a partisan for the most, but listen, I will give my opinion as asked, and I think Mayor Parker has done a very good job in the space of utilizing different resources such as community policing and things like that to help quell it. Now, again, you're going to see some things happen. We are
Of
also in
course.
the advent of social media, so everything is right in our face. But I do think we have seen some progress, personally. I think that going back to a previous conversation we were having, COVID, I think negatively impacted, a lot. And again, I'm a clinician by trade. So that's, I'm a professor of psychology, things like this. I look at it from a different lens. And social communication and being in person and learning and having your peers model different things for you is important. And when you don't have that present, for the huge gaps of times that we had during COVID, you will see adverse reactions. You will see the impact of that. And I think that's what we're seeing. And now we have to kind of reverse engineer things to hopefully get, this next generation of youth where they need to be. But COVID did not help.
I agree. And I do want to piggyback off of you. Mayor Parker is doing an amazing job. And we go way back to her Wadsworth days before she was Mayor Parker. But she's always been boots on the ground. She's always listened and she cares. And I think that is so important. So, yes, Mayor Parker is doing an amazing job. So please tell the viewers again how they can access services when they need to reach NAMI.
Yeah, so you can reach out to NAMI NAMIPHILLY. I just realized that rhymed. .org. So that is NAMIPhilly.org. You can find all our information. You can find out information about all the staff. You can find out information about me. But most importantly, you can find out information about all our resources, all our programming. However, if you need to, if you're having a little trouble navigating it, you can email me at KCARTER at NAMI, NAMIPHILLY.org, and I'll respond to you directly.
So let me ask you a question. If someone lives, and you said so NAMI is in Philadelphia County, Montgomery County, and the other counties, but it's statewide also, right?
Excellent point. So the way NAMI is comprised is we have a state organization, and that's known as NAMI Keystone. So that's our state organization, and then we're all affiliates that flow underneath that. So we all work together really well. We refer folks. So if we get somebody that's in Montgomery County, but they just happen to hear about NAMI Philly, we make sure we call Christine Stutman over in Montgomery County and make sure we connect them with that. So we all work symbiotically to ensure that everybody is getting what they need, no matter where they live in the state of Pennsylvania.
Okay. Okay. And is there an age range?
No, we are all inclusive from 8 to 80, whatever it is, and even beyond that. We serve everyone. So anybody that needs support, we are here to help you, no matter what.
Okay. Now, does NAMI have ongoing community events, or how can someone get involved? Is there volunteers? You know what I mean? So everybody at NAMI is actually employed. How can someone get involved through NAMI? And does NAMI offer services? I know you said mental health. What about, does autism fall under that also?
So yes, obviously we support everyone. We're completely inclusive. So of course we would serve the developmental disability and intellectual disability population. We're actually launching, coincidentally, a disabled person support group at the end of the month on March 30th. So I'll send some information on that. We'll make sure we blast it out to the community at large. It'll be on our website. It'll be on our social media, all that kind of thing. But yes, we serve everyone, and we absolutely do serve the disabled population. As far as the composition of NAMI. We have staff, so we're up to about 8 staff at this point. But then we also NAMI is an organization that is fueled by folks with lived experience and our volunteers. So we have amazing volunteers, facilitators that run our support group and table for us and support us, and they've been doing it for years and years selflessly. They are amazing, amazing people. So yes, we are always looking for folks that want to again get integrated with us. And you can go on the website. We have a contact us, a whole form that folks can reach out to James, who kind of runs that piece. And if you're interested in it, we will figure out a space to have you support the mission.
And I think peer-to-peer support is so powerful, because there's times where people could be sitting across from a therapist, and that therapist has no clue as to
Mm-hmm.
what this person has gone through. But peer-to-peer support is so important. So everyone employed at NAMI has gone through something. Is that right?
Absolutely. So it's not even just everyone that's employed by NAMI. It's all the volunteers. It's all the facilitators. It's all the board members. Everybody has some degree of lived experience, and quite frankly, we all do anyway. But everybody that's associated with NAMI Philly has some degree of lived experience in a mental health and behavioral health space, and that helps inform our level and our impact that we can actually have with the constituents that we serve.
Does NAMI have an office or offices located throughout Philly?
We do. So we have an office located with our partners at Friends Hospital, 4641 Roosevelt Boulevard. So we do host some events on that campus in collaboration with Friends. We host some groups there periodically. So yes, we actually do have a brick and mortar space.
And can you do walk-ins?
So we so everything will be handled via contact us. We will kind of look at the severity and the need of actual support and care, and we would determine what would be needed thereafter.
Okay. Well, I want to thank you so much for all of this great information. It's good. And people don't know about free resources that are available to them. And this is so important. You know what I mean? So this is great. I want to thank you so much for joining me today.
Thank you for the platform. Thank you for the invitation, and thank you for the work that you do.
Thank you.
Take care.
Thank you so much for joining me today. Please utilize this free resource. There are people out here that care about you and your well being. Peace and love.